Hey guys, welcome to Prasu'S Medledge. I hope you all are doing good and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now without wasting any time further, let's get into today's topic. So today's topic is Henoch-Schonlein Purpura, also abbreviated as HSP. Okay, so HSP is the most common small vessel vasculitis seen in children. Vasculitis means inflammation of the vessels. It usually presents with the clinical triad of non-thrombocytopenic palpable purpura, transient arthritis, that is inflammation of joint, and abdominal symptoms, basically diffuse abdominal pain. The symptoms of HSP usually follow an upper respiratory infection. Now coming to the diagnostic criteria for HSP, that is Euler criteria. So Euler criteria is the diagnostic criteria for HSP, which says that for diagnosing HSP, there should be presence of a palpable purpura with at least one of the following. So what comes in this following? First is diffuse abdominal pain, then any biopsy of the lesions showing IgA deposition, that is immunoglobulin A depositions, then arthritis, that is inflammation of joint, or arthralgia, that is pain in the joint, and renal involvement, which can be either hematuria or proteinuria. So any one of these plus palpable purpura if present, then we can diagnose Henoch-Schonlein purpura. Now coming to the pathology. So in pathology of HSP, we can see deposition of IgA and IgA immune complexes in the glomeruli. Now coming to the clinical features of HSP. So symptoms begin with a purpuric rash over the extensor aspect of the lower extremities and buttocks. This purpuric rash start as a pink macule or wheal, and later on it develops into a raised purpura, as you can see in the picture given above. That is the palpable purpura which is seen in the leg of the patient. Okay, that is the palpable purpura, that is raised purpura. Then other features include arthritis, arthralgia, renal involvement in the form of hematuria to nephrotic syndrome, neurological features which include seizures, then GI symptoms include colicky, intermittent abdominal pain, vomiting, diarrhea. Usually all the clinical features resolve spontaneously. So now coming to the investigations to be done in HSP, we can see leukocytosis, that is increase in WBC count, and thrombocytosis, that is increase in platelet count. Along with that, we will get elevated ESR and C-reactive protein levels. There will be increased serum immunoglobulin A levels. Microscopic hematuria can be demonstrated. Then we have to do USG abdomen, skin biopsy, and renal biopsy. In renal biopsy, we can see IgA deposition in the glomeruli. Now coming to the treatment. In treatment, drug therapy with prednisolone is given only in case of moderate to severe nephritis. Otherwise, we will just provide supportive care, that is, we will provide hydration to the patient and we will provide pain relief to the patient. Now coming to the prognosis in HSP, that is, HSP is usually a self-limiting disease, so prognosis is usually good. So now let's revise it once again. Okay, so HSP, the important points are that it is most common small vessel vasculitis seen in children. Clinical triad comprises of transient arthritis, abdominal symptoms, and non-thrombocytopenic palpable purpura. Symptoms usually develop after an upper respiratory infection. The diagnostic criteria is called as Euler criteria. Palpable purpura is must. Along with that, we can have any one of these, that is diffuse abdominal pain, biopsy lesion showing IgA deposition, arthritis or arthralgia, then renal involvement. Pathology I have already explained. Clinical features, mainly you have to remember about the purpuric rash, that is the palpable purpura seen in the lower extremities and on the buttocks, and in case of renal involvement you will be seeing hematuria, proteinuria, nephrotic syndrome, arthritis is also there, arthralgia is there. Neurological features include seizures. Then GI symptoms, that is colicky, intermittent abdominal pain, along with that vomiting and diarrhea can be also present. Usually these clinical features resolve spontaneously, and investigations I have already mentioned. So these are the following investigations. Leukocytosis, thrombocytosis will be seen, elevated ESR, CRP, elevated serum immunoglobulin levels, then microscopic hematuria, USG abdomen has to be done, skin biopsy has to be done, and then renal biopsy has to be done. And treatment is usually supportive in nature, that is hydration and pain relief is being provided to the patient, and prognosis, that is HSP is usually a self-limiting disease. So that's it guys, that was about HSP. I hope you like the video. If you like my content, please do like, share, subscribe and comment, and also press the bell icon to get notified whenever I post a new video. Thanks.